Okhla, New Delhi. His expertise is in the invasive cardiac procedures such as angiography, stenting, and rotablation. And I believe he's also an expert in cardiac physiology. And he is also an expert in device implantation, including pacemakers, combo devices, electrophysiology, and radiofrequency ablations. Cardiac catheterizations and interventions, including balloon dilatation of stenotic, aortic, mitral, and pulmonary valves, coarctation, dilatation, or stenting, and device closure of ASD, VSD, and PDA. So without much delaying, I will hand over to Dr. Vinay Jetli. Colonel Sahab, you may please continue now.
Yes, madam. Thank you so much for your elaborate introduction. So grateful to you and to your entire team. So today, I think over the next half an hour, we'll just speak a few words on heart disease and prevention and give a little overview to a general audience that what is the magnitude of disease which we face in our country. So just next slide, please. Can you just do it here? Next slide, please. Here. So some just one, just do it for us. Yeah. So just to see the overall volume of leading causes of death in developing countries. See, developing countries have a double whammy, that there is a large population in the developing country, and some of us are well-to-do. We are economically equivalent to the advanced countries, but there's a large population which is not well-to-do and which suffer from diseases of the previous century. But if you look at the leading cause of death, injury in the developing countries, overall in our country, with a population of say 135 crores, coronary artery disease is the #1 cause of death. So that's very important. And the #2 cause of death is major depression. So you can just see that how it has changed from the last century, where infections, especially in children, diarrheal infections in children under 5 mortality was a very important cause of death in the population. But now that has changed to diseases of lifestyle, in which coronary artery disease or coronary heart disease, coronary artery disease or atherosclerotic vascular disease is the leading cause of death. So what are lifestyle diseases due to? They are really related to obesity, which is an epidemic. Diabetes, which India is unfortunately the capital of the world, is not the future capital, but is the capital. We don't even know the number of diabetics in our country, because most of us are maybe diabetic. Some of us rather may be diabetic, and we don't even know about the fact that we are diabetic. So if you look at the prevalence of diabetes, that is the number of people who have diabetes in a country. So say if you have 100 crores and you have 15% who are diabetics, or 12 to 15%, so you have about 100 so you'll have about 15 crores. We will have 15 crores people who are diabetics, and they would be proven diabetics, and there would be some who are not diabetic or pre-diabetic. So the number is massive. Say 15 crores would be the population of many countries combined together who are diabetics. So if you are obese and you're diabetic, so chances of developing disease would be much more. Hypertension, as many as 25% of adults suffering from it. So if our adult population is 100 crores, so 25 crores would be hypertensive. Around 12 to 15 crores would be diabetic. So that's around 40% of the population having some lifestyle risk factor for heart disease. Coronary heart disease means that the arteries to the heart are blocked or getting blocked. And stroke is the arteries to the cerebral circulation, to the brain. And some area of the brain may get damaged because of this, and it causes stroke. That is, if the left side of the brain gets damaged, then the right hand and the right leg get paralyzed. So that is stroke. And osteoporosis is basically a disease of inactivity, aging, also more present in women. So, yeah, this just gets jammed a little. Yeah, sorry. So if we look at the epidemiological transition, that initially in our country, there were more deaths and equal number of births. And the problems were related to rheumatic heart disease, which is actually a disease of infections attained in younger age group and presenting with valvular heart disease subsequently later in life. So that's a disease which is still prevalent in India, which has got a very high prevalence because of the large number of population who live in very poor economic conditions, where infections in the throat can go from one person to the other. So that is rheumatic heart disease. But as we have grown in economically and as we have developed as a nation, their transition occurs to diseases of degeneration and man-made diseases. That is diseases of affluence, and they start contributing a higher percentage to the overall morbidity and mortality of disease volume in the country. And they are diseases of sedentary lifestyles, excessive calories, and leisure. That is leisure-related habits such as smoking. So this is what happens, and subsequently, as we learn about these diseases, we can transit into preventing these diseases from happening by preventing the occurrence of prevalence of risk factors by educational and behavioral changes leading to lower levels of risk factor, which is our aim today. That we want to spend about 10-15 minutes in a day just to tell ourselves what are these risk factors which we should avoid. So why do these diseases occur? Because as we economically develop, modernization increases our life expectancy. So when India got independence in 1947, the average life expectancy was 51, and individuals who retire at 50 years of age. Can you imagine retiring at 50 years of age? And now, when the expectancy of an average male in India is around 67, and that of a woman is 69, we are retiring at 60. But there are a large number of us who live much longer than that. And when we live longer, we develop diseases which are related to the diseases of sedentary lifestyle, that is related to urbanization and industrialization. And it is this combination of the gene environmental interaction. What it means is that we as South Asian Indians, which includes Indians, Pakistanis, Bangladeshis, Nepalis, Ceylonese or Sri Lankans, we are all prone to developing more disease, more cardiovascular disease, because we genetically come from a family of our forefathers were basically farmers in the fields, and our diets were related to eating carbohydrates and diets related to heavy physical activity. But now what has happened is that with the evolution or with the development of increasing life expectancy and increasing urbanization and industrialization, the environment, we are eating much more potent foods, much more high calorie foods, and our mechanical workload has reduced drastically, and hence we develop cardiovascular epidemic. If we have one pizza in one day for lunch, actually we have eaten for the whole week. We have eaten calories for at least 3 to 4 days, and we have done no physical activity in that. And that environmental interaction, the gene is what we have been born with. So the combination of this gene with the environment causes us to develop early atherosclerotic disease. Atherosclerosis is the process of blockages of the arteries, whether it's in the heart or, as I said, in the arteries to the brain. So the developing countries, we have a problem which we have a double burden, that is poor people as having diseases of infections, as well as rich people having middle class, a large middle class developing environmental factors developing diseases of sedentary lifestyle, and our resources are limited. So we have to prevent the development of these diseases. And as I said in the first slide, the commonest cause of death in India or in a developing country is atherosclerotic heart disease. So just see the number of people who will have heart disease in India or in the developing world as compared to the developed world. So early cardiovascular deaths occurred in much larger numbers in India and in the developing world. Even in the developing world, India was the largest. It's not uncommon to have people dying suddenly with heart disease. And increasing heart disease prevalence in India is both in the urban and the rural. Rural also because of, we will see the main risk factors, which include smoking. But the urban lifestyle, which is completely mechanized, we have such a wonderful metro rail. So we have 24/7 electricity with comfortable lifestyle. So we are eating well, and we are not exerting, and we just take the easiest mechanized forms of activity, and hence we develop increasing prevalence of heart disease. So this is what I have summarized. To summarize that the increasing prevalence of diabetes in India, which is 60, and now it becomes 57 as per the scale. That is, we are the diabetic capital of the world. As I said, prevalence of diabetes in India is almost 12 to 15% of the population. And if we look at the mortality of Indians of South Asian Indians who are living outside India, for example, Indians who go to South Africa or America or England, we find that the ratio, their chances of dying is much more as compared to individuals who are in their native countries. For example, an Indian going to America has a higher chance of dying because of heart disease as compared to an American in America, because the gene is not meant for the dietary indiscretions or the lack of physical activity, which the Caucasian gene, which is the gene from which is the white skin race, their genes are more resistant to the development of heart disease, or they develop heart disease at a later age. They also develop heart disease, but at a later age as compared to South Asians who develop it at a much younger age and develop more severe disease as compared to the equivalent population in the Western world. So this is just a heart. This is just a representation. This is how it actually looks. This is the right coronary artery. This is the left-sided arteries. Just to give you a little idea that this is the normal clean artery, but this is the artery which is irregular and blocked by the atherosclerotic. This is the material, cheesy material. Atherosclerosis is the process of blocking the arteries with this cheesy material, which is the fatty material which is deposited in these arteries. This is a normal artery when you cut. This is a postmortem specimen. This is a nice lumen, clean lumen. And this is how it looks when it is blocked. This is opened up, cut open, and this is a blocked artery. There's no lumen. So this individual has died because of this blockage which has occurred. The lumen should have been like this, where my arrow I'm showing here. But here it has got blocked because of the thrombus which is formed, the clot which is formed with in that particular artery. This is occlusive thrombus, is how it looks to the eye, and that was under the microscope. So this is how the process starts. So this is important to remember, that the process of blockage in the artery starts at a very young age. At the young age, the fatty streaks and fibrous plaques at 20 and 30 years of age. And by 40 years of age, the clinical symptoms of chest pain. So if the chest pain is developing at 50 years of age, it doesn't mean that the disease has started 2 years earlier. It has started at least 2 to 3 decades earlier. That means the process of having a healthy life should start right at this young age. As a teenager, we should look after ourselves. And only if we look after ourselves from that age will we prevent the developing of the blockages of the various organs of the body. So if the heart artery gets blocked, we get chest pain. If the artery to the brain gets blocked, we get a stroke. If the artery to the limbs get blocked, then we get pain in the legs or gangrene in the legs become blue. And if it just deposits in the artery of the abdominal aorta, that is the abdominal arteries, the artery dilates, and this can rupture and cause a sudden death. So what I'm trying to say here is that the process of blockages of the artery starts in the teenagers. So we cannot say that I'm young, I can eat everything. The healthy habits, good habits should start right at a younger age. So early good behavior will prevent this burden of disease developing at 40 years of age. This 40 will probably go up to 70 or 80 and increase the lifespan of the Indians in our country. So this is how we do an angiography. This is our catheter. This is how it looks on the radiograph on the X-ray. This is the catheter which has engaged the artery of the heart. This is one of the arteries. This is the other artery where my arrow is. There's a tight blockage here. These are the various catheters, how we put stents, balloons, how we dilate. So various methods to this is how we do a bypass surgery. But what I want to say here is that a treatment. This is not the point at which we want to intervene, that when you develop chest pain, you come to us. No, that is not the point. We have to have population-based strategies in which we prevent the development of risk factors so that we don't develop that disease. Once we have developed the disease, then we are fighting. We are already lost half the battle. But if we prevent the risk factor from developing, what is the risk factor? It is a factor which predisposes to the development of blockage in the various arteries of the body. If we prevent that risk factor, then we are preventing the burden of the disease in our country. That is more important. That if out of 100,000 people, if 700,000 or 800,000 people walk daily, eat healthy food, then they will not develop disease, and their chances of in that population, the number of people who will develop disease will be less. But if out of 100,000 people, only 5,000 or 10,000 are exercising, then 95,000 people, the number of people developing heart disease will be much more. So burden of disease will be much more. So there are some non-modifiable risk factors. Heart disease comes at a age as the age increases, so that we cannot stop. The males are generally more prone to developing heart disease as compared to females. Females in their pre-menopausal age have a lesser incidence of heart disease. The estrogens prevent heart disease as compared to the equivalent age in the males. But after menopause, the risk is the same in males and females. Now, what are the modifiable risk factors which are established? The most important are as follows: smoking and tobacco abuse. So smoking is a of tobacco abuse. Tobacco abuse need not be in smoking. Even using tobacco in any other form is equally harmful. So we what do we want? We want good good cholesterol levels. Sorry, good cholesterol levels, or rather high good cholesterol levels are bad for the body. So high bad cholesterol levels. Sorry, I again repeat myself. High bad cholesterol levels are bad for the body, and high bad, that is the LDL cholesterol, which is called the bad cholesterol, and the good cholesterol is LDL is the bad cholesterol and HDL is the good cholesterol. And the HDL cholesterol only increases by exercise. Only exercise increases the good cholesterol in the body, while the bad cholesterol will go up with bad dietary habits, which we will just see in a short period of time. High blood pressure is equally important as a risk factor for developing arterial disease, atherosclerotic arterial disease. Obesity, especially obesity around the waistline. So we should have, if obesity is present, it should be like an apple. We should be obese. The whole body should be obese. We should not have obesity which is pear-shaped. That means obesity around our waistline. That is a very bad obesity that it predisposes to atherosclerotic heart disease. Diabetes mellitus we have already discussed. Physical inactivity, as I said, high physical activity increases good cholesterol, which is the HDL cholesterol. And of course, mental stress and other psychosocial factors are also important in development of atherosclerotic heart disease. So in emerging risk factors, we will not go into that may not be important in this audience. So to discuss, the smoking increases the risk of development of heart disease by 1.5 times. High cholesterol and smoking 3 times. So it is an double the risk. Normal BP, normal cholesterol, no smoking, low risk. The risk cannot be zero. Unfortunately, we all have to develop some disease at some time for age. So if we have normal BP, normal cholesterol, and we are not smoking, our chances of developing of disease is less. It is not zero. But if we smoke, we have high cholesterol and we have high BP, our chances of developing heart attacks and disease increases exponentially. It will increase by about 5 times. So this is the classification of our blood pressure. So what we say is that we generally require blood pressure, systolic blood pressures less than 140, and diastolic blood pressures, that is the lower blood pressure, should be less than 70. So if we have less than 140/90, our blood pressures are generally in the normal range. Higher than that is higher blood pressure, and it requires more treatment of the blood pressure. Blood pressure can also cause hemorrhages in the brain. The weight has to be less. So this is a body mass index. It is calculated by weight divided by height in meter square. So our weight should be, our body mass index should be between 19 and 24. Ideally, it should be less than 23. More than 30 is called morbid obesity. And if it is 40 and above, it is severe obesity, which may require special surgeries to reduce the size of the stomach so that the weight of the individual reduces. LDL cholesterol, we want LDL cholesterol should be less than around 115 on average, the bad cholesterol. If we have multiple risk factors, then our cholesterol should be even lower than 115. It should be ideally in double figures. The HDL cholesterol, which is the good cholesterol, has to be high. So in males, it should be greater than 45, and in females, it should be greater than 55. Serum triglycerides are not directly related, but they're related to intake of carbohydrates and sugars. So high, the level, normal level is less than 115. High levels which require treatment are generally more than 500 milligram per DL. So they reduce by reducing our sugar intake and our carbohydrate intake. Our blood glucose levels should be less than 100 fasting, and postprandial should be less than 140. So there are various intermediate stages. So this is the figure. On fasting, there should be double figures, and in the postprandial, immediately 2 hours after your meal, that is postprandial means food, it should be less than 140. So if we look at the estimated risks factor profile in Indians, in males which are 35 to 58 years. So a large number of us in this age group, in the male age group, will have tobacco usage, whether it's smoking or tobacco usage. So rural India, tobacco usage, BD smoking is quite common. So that predisposes to heart disease in the rural India. We are obese. A large number of us in the urban area are obese. Our body mass index is more than 37. WHR means waist hip ratio more than 0.95 is present in large number of us. That is pear-shaped obesity. Pear-shaped obesity predisposes to heart disease. Around 20 to 30% of individuals have hypertension. Diabetes, as I said, 12 to 15%. This study showed around 10% in the urban area. Rural area, maybe individuals are physically their work schedules are more hectic, so they develop less diabetes. And of course, total cholesterol levels more than 35%. I mean, having more than 200, and triglycerides are having around 46%. So what it tells us is that almost 1/3 or 1/4 of 1/3 to half of the population has some risk factor to develop heart disease, and this is one of the reasons why we are developing a heart disease at a younger age group. So I think I will not speak more than this. I think we will leave something for the question answer session. What I will just talk about is a little bit about the prevention as far as what we can do. So I think we should have optimal nutrition. Optimal nutrition, we can have some question answer sessions on that. Optimal nutrition means that we should have more of vegetables and fruits of the season. So this should be a pyramid of our diet should be like a pyramid. That means the tasty things, that is the sugars, the non-vegetarian part, and the tasty things, cheese, that should be the apex. That should be less in quantity, while the base should be full of vegetables and fruits of the season. So a food pyramid should be made in which the maximum intake is of the fruits and vegetables of the season, and that contains a lot of fibers. We should be physically active. Physical activity is very important. It is important to for the heart. It is important for the muscles. It is important for the bone turnover. It reduces the prevalence and incidence of diabetes. It improves the glucose utilization in the body. And we should also be mentally at peace with ourselves. All work and no play makes Jack a dull boy. So a little bit of recreation should be there. Some kind of hobbies should be there with us. Emotional security, social interactions, humor. They important rest and sleep, a healthy attitude towards work. And we should avoid substance abuse such as tobacco, BD, cigarettes, alcohol. Alcohol has a direct effect on the heart and it increases loose behavior and increases food intake. And of course, we should avoid recreational drugs. So, madam, I'll stop here. And I think if you want, we can have some question answer session, and then we'll be able to carry on with the same topic. Thank you very much. Can you hear me, madam?
Thank you, Doctor Sir. It was a lovely session. And I'm sure all the people here, they must be having plentiful of questions because as you know, India, it has got maybe 9.2% diabetes, but at NTPC, we are still more because our life
Yeah.
is still more sedentary.
Yes.
So I think we can start the question answer session. Anyone, please start off the question answer session.
Yes, sir. Can you hear me? My name is Sandeep.
Yes, Mr. Sandeep. Yes.
Sir, we work here in shift and our shift changes every 2 days and our sleeping time also changes with that.
Yes, sir.
So
Yes.
it's causing a great stress. We always feel underslept. So
Yes,
what
sir.
are the steps regarding the CHD and what can we do to overcome
Yes.
this?
Yes, I think your point is very valid. But I must tell you that I, as a doctor, and I am almost reaching my sixth decade of life, and I still get up in the night at least twice or thrice with calls. So I think all of stress is a part of all of us. Any developing nation or any nation worth its substance, individuals in that nation have to work very hard. But we have to find our time for ourselves in spite of our work schedules. You can imagine a doctor coming in the middle of the night and then treating patients who are in very difficult situation, going through going through night duties for days together, for 2 weeks, 4 weeks. Look at the nurses; they work for 4 weeks. Look at the military forces and the paramilitary forces. So what I would say is that stress is an inevitable part of life. But handling stress both emotionally and physically is equally important. So what it tells me is that in our work, when we finish our workplace, or when we go back home, there should be some time taken out by us for some kind of physical activity to keep ourselves physically fit. Because only a physically fit individual is a mentally fit individual. So I think that if you are having times, after all, duties are not present at odd hours throughout the year. So when they are present, we have to live with that period. But after that period, we should or even in that period, we should go home, rest, and when we can change our biological cycles change accordingly. After all, there are a lot of pilots who work through they go through night stress. They go to different time zones. But we must take out time to do physical activity. If physical activity to take out time after a day's work is one of the hardest things to do. But we as a religion should do that. That we have to say, okay, look, I am going to spend 45 minutes or 30 minutes of a day doing some physical activity. And if we do that physical activity and we eat a balanced diet, our diet should be very balanced, and they should not be heavy. They should not be full of fatty food or simple carbohydrates. So a good physical activity along with dietary discretions and a disciplined life will allow us, even with difficult times, to come out of a bad scheduling as far as the workplace is concerned. Yeah. Yeah. Can madam hear me?
Yeah, I can hear you. Anyone
Yes,
else?
Hello, good afternoon, sir. This is Premanand.
Yes,
Actually,
sir.
I have a doubt regarding heart stroke, first stroke. So I
First
have,
stroke.
yes.
Yes.
I have read somewhere in some internet blogs regarding first stroke. There will be some symptoms before 1 month.
No, I don't think so. I
Symptoms.
think that yes, I get your point that your what is a stroke. So I'll just talk about the stroke in a little bit of a background, so that will give you an idea about what is a stroke. Stroke happens when the internal carotid artery, that is the artery supplying the brain. There are two arteries which supply the brain from the main artery, which is the aorta. So the blockage of these arteries, just as the blockage of the heart arteries, they also start at a younger age. So if one of these arteries gets blocked more than 70%, then the area of the brain gets a less blood supply. But stroke occurs if there is zero supply to some area of the brain. So it is possible that you may have some symptoms of stroke in the past. It is also possible that stroke may be the first symptom of a blockage of the arteries to the brain. Just like as a heart attack, the individual may have some symptoms to suggest that he's got blockage of the arteries in the form of angina. Similarly, in the stroke, individuals may have what we call transient ischemic attacks. There's some clot formation, it goes to the brain, it causes a symptom, becomes all right. So that may be present and it also may not be present. So it is not 100% symptom which has to be present before an individual develops stroke.
There's one more question.
Sir, one more question, sir.
Yes.
Hello.
Yes, I'm listening, sir.
Sir, I was infected last June, with COVID positive.
Yes.
After that,
Please mute the mics, please.
Hello.
Yes,
So actually, I feel some kind of suffocation or some when I am not feeling like I was feeling before. And
Yes.
when I went to hospital and everything was fine. I got tested by myself. Everything
Yes.
was fine. But
Yes.
I'm not convinced with the results. What are the tests I've done? Sometimes in a cold, severe cold, I feel
Yes.
very much suffocation during especially during night and in the morning.
Yes, sir.
Is that any?
So what I would suggest to you for your personal problem, you have to go to your doctor. Madam will be able to assess you better, but I can give you an overview of COVID and heart disease. Okay. So COVID generally post-COVID symptoms can be present in individuals for up to 3 to 6 months post-COVID. So we have something called a long COVID symptomatology, which can include palpitations. It can include heart palpitation, means the heart rate beating faster, higher blood pressures. It can also symptoms of brain clouding. So this kind of a suffocation which you are feeling. So these are symptoms of long COVID. They are not very uncommon. Having said that, they are likely to resolve over a period of 3 to 6 months. Having said that also, an individual, whether he has underlying heart disease or not, should go to the individual doctor or to the doctor where he is going to exclude that. As far as COVID is concerned, your symptoms are suggestive of long COVID, which will settle down over a period of 3 to 6 months. Yes, madam. Should we make it the last question, madam, now?
What is sinus bradycardia and how it's bad for our heart?
Yeah, so sinus bradycardia means when the heart rate normally is from 60 to 100 beats per minute. When it is less than 60 beats per minute, it is called sinus bradycardia. When it is more than 100 beats per minute, it is called sinus tachycardia. Sinus bradycardia is a common finding in individuals who are athletic. For example, in soldiers, physically fit human beings, athletes, most of them will have heart rates less than 60 per minute. Individuals who are not athletes and who are having heart rates less than 60 per minute may be present because of some drugs, for example, anti-blood pressure drugs which we take. Some of them cause a reduction of heart rates. If there is no such drug intake or individual is not very is not a athlete, not habitual as far as physical exercise is concerned, then individuals with slow heart rates should be investigated by the referring to the doctor. I think we can finish at this particular time.
Doctor, one question.
There's one more question from Mr. Rajendra.
Yes,
he
sir,
wants to know what is mitral regurgitation and what are the precautions to be taken if it is on the milder side.
Yes, ma'am. So mitral regurgitation, the heart has got 4 valves. The right side of the heart is the tricuspid side, and the left side of the heart is the mitral side. So mitral valve is present between the two rooms of the heart, which are called left atrium and left ventricle. So when the blood is pumped from the left ventricle, it should go all into the body, into the aorta, through the aorta. When all of it is not going into the body through the aorta, some of it goes back into the chamber from which it has come, which is the left atrium. Then it is called mitral regurgitation. So for example, if there are two rooms, there should be an exit out of the two rooms. So instead of the blood exiting out of the two rooms, it goes back into the room from which it has come. If it is a mild regurgitation, it is commensurate with normal life. It requires not much of a problem. It is not much of a problem. The etiology of the mitral regurgitation has to be ascertained, meaning thereby that what has caused that mitral regurgitation. In India, the common causes are rheumatic heart disease, which I have mentioned is a disease of a sore throat which has affected the heart in younger age group and has affected the mitral valve. So it has caused a mitral regurgitation. If it is mild regurgitation, it is likely to remain mild for most part of that life. The other cause can be a mitral valve prolapse. So that is an anatomical abnormality of the heart in which the valve, while closing, it prolapses back into the left atrium. What is to be done for mitral regurgitation? Mild mitral regurgitation, no drugs are required, and possibly once in 2 to 3 years, the mitral regurgitation has to be ascertained on an echocardiography and to be seen that the mitral regurgitation, the mild mitral regurgitation, does not increase in severity. That's all that is required.
Doctor, so one question regarding this heartbeat.
Yes, sir.
Actually, my normal heartbeat is it's a 90 to 100,
Yes.
and during bedtime it is okay. It is around 70 to 75.
Yes.
But the
Yes,
issue is I don't think anything bad. But suppose
Yes,
it is
very
90 and I hear some bad news or negative news, then I
Yes.
feel something like dizziness. So is there any natural
Yes.
way to reduce this heartbeat, or is it okay with it 90 or 100?
Yes, sir. So the range of the heartbeat to normal people, as I mentioned, is between 60 to 100. Individuals who are athletic, who are physically very active, their heartbeats are on the lower side, that they come to 60, 65, 70. But individuals who are less active, their heartbeats are between 90 and 100. The heartbeat slowing down at sleeping time is a normal phenomenon. The body wants to rest the heart, so the heart rate slows down. Nothing to be done. What I would recommend to you is that you increase your physical activity and follow all the lifestyles which I have already mentioned as far as physical activity is concerned.
How to manage this negative thought? Because of negative thought, our heartbeat raises to 120, 130, something like that.
Yes, so negative thoughts is
somebody handles it
yeah.
very nicely, but
Yeah.
how to do it?
Yeah, so I would suggest to you, sir, is that increase physical activity, and this is a psychological issue in which negative is bad for everybody. Even if I get negative news, I also, my heartbeat also increases. If I get scared, my heartbeat also increases. So there's nothing abnormal in that. You have to design yourself, or you have to mentally become a little stronger so that you take bad news in a little better manner, which does not affect your heart. The heart is responding to your personality, and I don't think there's anything wrong in the heart. I think, madam, if you permit me, I will have to stop here because already. Yes, we'll make it the last question because I'll have to go after this immediately. I don't have. Yeah. Please tell me.
Sir, I have a question.
Yeah.
Yeah, the hypoglycemia, how it affect the heart performance?
Yes, so hypoglycemia, very important question, sir. A large number of us are diabetics. So hypoglycemia causes the heart rate to rise and the blood pressure to rise. What does it cause? When the blood sugars go down, the heart rate starts increasing in the intensity as well as the rate. So there are some hormones which are produced by the body when the blood sugar goes down, which are called the adrenergic hormones. So they cause increase in the contraction of the heart as well as the tachycardia, which is called the increasing the heart rate. And because of these hormones, the blood pressure also goes down. Individuals may have sweating, and if the blood sugar goes down below 30 or 20, individuals may lose consciousness. So hypoglycemia, this is if they are awake. If hypoglycemia occurs at night time, suppose individual takes some drug in the night or insulin at night. So in the middle of the night, say around 2 o'clock, 2 a.m. or 3 a.m., individuals may get up with a feeling of palpitations, a strong heartbeat, but they may also have feeling of sweating, which is also a feature of hypoglycemia. So sweating, increasing heart rates, increasing blood pressures, a feeling of pounding of the heart, these are features of hypoglycemia, meaning thereby that the blood sugars are low.
What is
So
the
I think Madam, if you permit me, I would say thank you to all of you for listening to me, and it was a great pleasure, and I'm very grateful that so many questions were asked. Maybe we can have a meeting some other time after some weeks to follow it up.
Thank you,
very
Colonel.
much.
It was a pleasure
Yeah.
having you with us, and I'm sure we'll have further interactions with you all as well. Thank you so much.
Thank you, ma'am. Thank you. Such a pleasure for me.
Thank you, ma'am.
Thank you.